You with Dave on Ultra 1065 as we have a look today at our health records. Of course, we've had floods and bushfires, now the COVID-19 pandemic, and facing an ongoing emergency situation. It's possible that your health record, my health record, may be the thing that you need. Independent clinical advisor at the Australian Digital Health Agency, Dr. Steve Hambleton, is joining us. Steve, this My Health record's been around quite a while, but some people haven't quite kept it up to date.
Well, that's right, but it is starting to mature. So each time you touch the health system, should you be in hospital and be discharged or get a medication prescribed, that information can flow to your My Health record. And that can be really, really useful in an emergency or when you can't get to your GP. Or, you know, that piece of paper we give our patients, you might have lost that. And if you can get all that information on your My Health record.
Now, to initially start up a My Health record, I mean, everybody sort of has a number or a place to go. What's the easiest way to get started on the process if you remember when it sort of came on board but you didn't do anything with it?
Well, in fact, we moved to an opt-out situation a couple of years ago. So 23 million Australians today have a My Health record, and there's more than 20 million of those have got some form of data in them. And in addition to that, people who perhaps opted out initially because they were a bit concerned are opting back in. And now more than 70,000 people have said, well, yeah, maybe the benefits are worth it and I'm going to get back in there. And you can go to your GP and have that done. You can actually do it online. You can actually ring up the phone number and we can start a record. Of course, from that day, it will start to record events, things like prescriptions you get prescribed, a discharge summary from a hospital, or pathology and maybe radiology results will start to go to your record, and you can control those.
For somebody, I must be in the 3 million because I have a health record, but it doesn't seem to have anything in it.
Well, that's right, and I think that's the important thing. It doesn't actually sweep up everything from the past. It's from today onwards that it'll start to record things. So if you've been well and you haven't been to your GP very much, there may not be a lot in there. But if you get a medication prescribed, if you have a vaccination, and of course we're rolling out the COVID-19 vaccine now, that will go to the Australian immunisation record, which you can view using your My Health record. And there's a couple of apps that you can put on your phone, and you can get rapid access using that as well.
Interestingly, of all my children who are now all grown up and adults, I can only remember one of them actually having an immunisation record delivered from the government at any stage. The three that are slightly older than that didn't seem to have one, but at least I've got hers if I've got nobody else's.
Well, that's right, and the AIR grew out of the childhood immunisation record, and there's a lot of young people will actually have information about their vaccinations. You know, if someone said to me, when was your last tetanus needle, or even more important, when was my last whooping cough vaccine, I'd probably stare blankly, but if I jumped onto my app, I can actually tell you the date and whether I'm actually due for the next one. And that's one of the upgrades that's happened recently. If you want to look at your immunisation record, we combine, the My Health record automatically combines information shared by your GP and the information shared from the AIR, the Australian Immunisation Register. You can see it on one page.
So that's a sort of one-stop place to go. And I suppose if you have an accident or you end up in an emergency department, rather than the hospital racing around to chase your records, if they know you've got a My Health record, it makes it a lot easier.
Well, it certainly does. And there's a lot of shared health summaries out there now, something like 6 million shared health summaries that GPs have created. So there's an increasing volume of useful information on that record, and we need to get the emergency departments to start opening it more routinely to make sure they check, because information that they need will be right there in a lot of cases.
Now, if we happen to be missing documents once we start to upload things, how can we go about that? Because historically speaking, I mean, I'm in my late 50s. A lot of things happened to me when I was in my teens and 20s. In fact, a lot of my hospitalisations occurred in that sort of time zone for various different things. How does that information get put through?
Well, some of that information is very important too, and I'm a GP, and what I try to do is health summary for my patients and detail some of that past history. You know, it is important to know you've had a general anaesthetic in the past, or there might have been an operation that's significant to today. And that becomes part of your health summary. If I then create a shared health summary, upload it to your My Health record, it's available to you and to any other provider that you see. Of course, you have full control. If you have a look at that and it's got an error, you can remind me. You can actually take it down if you want to. or you can restrict who can see parts of the record. It's fully in the patient's control.
Well, now's as good a time as any with the COVID-19 vaccine and some of the changes that are occurring with that to make sure that we do keep our health record up to date so that it is available to those that see it. Steve, thank you very much for your time on our program today. It's been wonderful to catch up and remind people of this very important message.
Yeah, thank you very much.